Okay, na? This is the specimen of spinal cord, which is a part of central nervous system, and it extends downwards as a continuation from medulla oblongata from the upper border of first cervical vertebra, and it extends up to the lower border of L1 in case of adults and L3 up to in case of children. So when you see the spinal cord, you can appreciate two enlargements. You can see this is cervical enlargement. You can see this is lumbosacral enlargement. This is from L2 or L3 to S3. यहाँ पर सारे lumbar and sacral nerves आ जाएंगे. यहाँ पर this is the cervical enlargement where it gives out to the cervical spinal nerve and upper thoracic, that is C5 to T1, T2, that is involved in the formation of brachial plexus. So this spinal cord is covered by meninges. There are three meninges which are covering. The outermost is dura mater, then you have thoracoid mater, then you have pia mater. Okay. Dura mater एक ही layer का रहता है. This is a single layer of dura mater, and the dura mater extends from the foramina magnum up to the S2 vertebra, whereas the pia mater, which is the innermost layer, which is adherent to the spinal cord, and it extends downwards from the tip of the spinal cord as phylum terminale. So the part which I am showing is the phylum terminale. This is one of the modifications of the pia mater. Okay. There are four modifications of pia mater. That is linea splendens, subarachnoid septum, ligamenta denticulata, and phylum terminale. Phylum terminale is around 20 centimeter in length, and it is divided into two parts: phylum terminale internum and phylum terminale externum. From the tip of the spinal cord, that is from the conus medullaris, okay, up to the S2 vertebra, that is phylum terminale internum. After that, it pierces the dura mater and goes and attaches to the coccygeal vertebra, that is called as phylum terminale externum. Apart from that, I will show another modification of pia mater, that is called ligamenta denticulata. These are tooth-like projections. You can appreciate here. These are tooth-like projections which extends laterally from the pia mater, pierces the arachnoid mater, and gets attached to the inner side of the dura mater. So there are 21 pairs. Okay, ligamenta denticulata. The last pair will be at the level of T12 and L1. And after this cervical enlargement and lumbosacral enlargement, the lower part of the spinal cord is called as conus medullaris. This part is conus medullaris. As the vertebral canal, as it is present in the vertebral canal spinal cord, it presents up to the lower border of L1. It occupies the upper two-thirds of the vertebral canal. But vertebral canal is quite longer than the spinal cord. So the lumbar and sacral nerves, they have to move downwards so that they can emerge out through their respective intervertebral foramina. So this lumbar and sacral bundles of nerve fibers which move downwards within the vertebral canal and comes out in the respective intervertebral foramina is called as quada equina. So these bundles of fibers are called as quada equina fibers. And also you can make out the anterior median fissure, which you can see. And when you see the cut section of the spinal cord, you can see there is a butterfly shaped gray matter. There is a anterior median fissure, and you can see peripheral white matter. This white matter is divided into anterior column, lateral column, and posterior column.